This video will educate on what is carpal tunnel syndrome, how it is caused, what are the ways in which you can prevent its occurrence, and what are the treatment options based on the severity of symptoms that you have. So stay focused and watch this presentation. You would have heard or felt for yourself that the hand gets numb, or have tingling sensation in the night, and in many it may be severe enough to disturb sleep. These are the initial symptoms of a condition that is termed as carpal tunnel syndrome. This occurs due to compression over a nerve called median nerve that passes under a ligament in your wrist. This ligament forms a tunnel that is named as carpal tunnel, and thus the compression of nerve in this tunnel is termed as carpal tunnel syndrome. To better understand carpal tunnel syndrome, it helps to know a little more about repetitive strain injuries, as the two conditions often go hand in hand. Because repetitive strain injuries are the result of moving the same muscles, tendons, and nerves over and over again, individuals with certain occupations are more likely to develop them. Carpal tunnel syndrome is more common in females, in the age group of 40 to 60 years, although males are not immune to getting this condition. It's believed that idiopathic carpal tunnel syndrome may be related to hormonal changes in females in this age group. Now that we have some cursory knowledge of what is carpal tunnel syndrome, let's take a moment to familiarize ourselves with some of the first symptoms of the condition. Those who develop carpal tunnel syndrome will often experience the following symptoms: burning or tingling sensations in your hand, hand numbness at night in the palm of the involved hand, shock-like sensations in the fingers and hand, a decline in pinch strength while holding objects, pain in hand mainly at night or while working, itchy palms, change in hand temperature, changes in skin color, unable to make fist and stiffness of the fingers mainly on getting up in the morning. In addition to repetitive stress, many other factors can increase one's risk of developing carpal tunnel syndrome. Some factors include obesity and chronic health problems, such as thyroid disease, diabetes, and arthritis. Not surprisingly, wrist fractures also contribute to it. If you're experiencing any of the symptoms mentioned here, it would be a good idea to be seen by a hand surgeon as soon as possible. After all, doing so will help you determine whether or not your condition is associated with an underlying health problem. In either case, your doctor will be able to outline a course of treatment that addresses your illness or one that resolves your symptoms. Beyond that, he or she will likely also take X-rays to confirm your symptoms are not related to a wrist fracture. Along with taking X-rays to rule out wrist fractures, most doctors will perform a few tests in their clinic to assess your symptoms. These tests are made to irritate your nerve and see if it has become supersensitive, or is functioning less. Your doctor may prefer to get an ultrasonography done to see the diameter of your nerve and to see if it has reduced. This reduction in diameter is a sign that the nerve is getting compressed. Electric conduction studies of the involved nerve may be undertaken to see how much conduction loss has occurred. All said and done, it needs to be emphasized that the diagnosis of carpal tunnel syndrome is mainly clinical, and the tests are usually required to substantiate the clinical examination findings. Once a diagnosis of carpal tunnel syndrome is made, the examining doctor needs to judge the severity of the disease. If you have only numbness and tingling, with no weakness in your hands, then probably you are suffering early symptoms. In such condition, physiotherapy and activity modification will ease your symptoms. In a few cases not responding to the above measures, 1 or 2 doses of local steroid can be given to relieve symptoms. If the cause of carpal tunnel syndrome is a reversible cause, like swelling in cases of pregnancy, this steroid dose will improve the symptoms forever. However, if the cause is mechanical compression, then these measures may not provide long-lasting relief. The sign of severe carpal tunnel syndrome are loss of sensation in the thumb, first and second fingers, along with weakness of the thumb muscles, causing a numb hand, with minimal pain, but weakness and clumsiness in holding small objects. Many patients only consult at this stage. Depending on how long you have been having these symptoms of severe compression, a surgical release of the ligament, compressing the nerve, can be done by a small incision surgery, or with help of an endoscope, the tunnel can be released. Majority of these patients will gain their sensation and power of hand in following 4 to 6 months of surgery. In few late presenting cases, the surgical release may only help provide relief in pain and numbness. An additional procedure to get the thumb function improvement may be required. This procedure is called as opponentsplasty. All in all, carpal tunnel syndrome can have a profound impact on your day-to-day life. That's because it affects nearly everything that requires the use of your hands. Fortunately, the onset is very gradual. Therefore, you have enough time to schedule an appointment with a hand surgeon before it gets worse. It needs to be emphasized here that carpal tunnel syndrome, if treated early, will make your hand as normal as it was prior to onset of symptoms. You need not fear, but seek help if you are suffering any of these symptoms.